In the heart of winter, when breath turns to fog and windows frost from the inside, there was a rule, not written in medical journals, not sold in pharmacies, not advertised between commercials, a rule passed from grandparents to parents, from villages to farmhouses, from sick rooms to sanatoriums. And for generations they swore it stopped coughs in their tracks. They called it the winter air rule. And you know, it sounds completely backward. When the coughing began, when the chest felt tight, when the nights grew restless, they opened the windows, in January, in snow, in freezing air. Today, that sounds reckless. We're told the opposite. Stay warm. Seal the drafts. Keep the cold out. But across Northern Europe, early America and mountain communities, families believed something different. Stale air was more dangerous than cold air. Why? In the late 1800s and early 1900s, physicians began noticing patterns. Patients with respiratory illness often improved in well-ventilated spaces. Sanatoriums were built in mountains, forests and coastal climates. Windows stayed open, even in winter. Patients were wrapped in blankets and placed on balconies to breathe cold air for hours. One early advocate of mountain air therapy was Hermann Bremer, who believed fresh, cool air played a central role in recovery from tuberculosis, decades before antibiotics existed. Primitive medicine, or careful observation? Hospitals at the time were designed with tall ceilings and cross-ventilation. Fresh air wasn't optional, it was structural. And coughs? They often eased. Here's where it becomes less folklore and more biology. Cold winter air is typically drier. It often contains fewer allergens than indoor air, and it dilutes airborne pathogens rapidly. Inside a sealed, heated room, humidity drops, dust circulates, carbon dioxide rises, viruses linger, your throat dries out, inflammation increases, coughing becomes reactive. Step outside into crisp air and something subtle happens. Blood vessels in nasal passages constrict, swelling can temporarily decrease. Breathing feels sharper, cleaner. Even modern ventilation research confirms this. Airflow dramatically reduces airborne particle concentration. So the old rule wasn't mystical, it was mechanical. The 20th century changed everything, didn't it? Central heating, insulation, double-paned windows. Sure, comfort improved, but, well, airflow declined. We began treating homes like airtight containers. Winter became something to hide from, you know? And slowly, the winter air rule vanished. Instead of opening windows, we added humidifiers. Instead of cross-ventilation, we used recirculated heating. And cough syrups multiplied. Coincidence or consequence? Scandinavian parents, historically, let infants nap outdoors in winter, bundled carefully, breathing cold, fresh air. In parts of Eastern Europe, bedrooms were aired nightly, regardless of temperature. Early American farmhouses had a daily ritual air, the sick room. No one thought it revolutionary. It was just hygiene, really. And yet today, suggesting someone open a window in January feels almost rebellious. Why did fresh air become controversial? During recent global respiratory crises, public health officials emphasized one key factor: ventilation, open windows, increase airflow, reduce indoor concentration. Suddenly, a centuries-old practice resurfaced, not as folklore, but as guidance. Indoor air, according to modern building science, can be significantly more polluted than outdoor air, even in cold weather. We feared the cold, but ignored stagnation. The winter air rule wasn't anti-science, it was pre-modern science. Let's be clear, cold air alone doesn't cure illness, and, extreme exposure is dangerous. But moderate, controlled exposure? Well, that's different. Brief cold air inhalation can sharpen alertness. It can reduce the perception of nasal congestion. It may temporarily calm inflamed tissues. Modern figures like Wim Hof have popularized cold adaptation practices, though often in dramatic form. But long before ice baths trended online, villagers simply cracked a window. No biohacking, no branding, just airflow. There's another layer most people overlook. Fresh winter air feels clarifying. When someone is sick, heavy indoor air can intensify discomfort. A stuffy room amplifies the sensation of being unwell. Opening a window changes more than temperature. It changes perception. The room feels lighter. Breathing feels intentional. Anxiety softens, and anxiety fuels coughing. Sometimes relief begins with environment, not medication. Now, here's the uncomfortable thought. Why is ventilation rarely the first recommendation for a winter cough? Why are we taught to seal ourselves indoors, then treat the symptoms that follow? There's no secret council banning fresh air, but there is a cultural shift toward convenience and consumption. Fresh air can't be patented. It can't be bottled. It doesn't come in cherry flavour. So it faded quietly into the background. The winter air rule was simple. Air the room daily, even in winter. Avoid overheated, stagnant spaces. Bundle the body, but refresh the air. Use cold strategically, not fearfully. It wasn't extreme, it was balanced, and balance often looks boring until you need it. If you're dealing with a mild winter cough, and it's safe in your climate, try this: open your windows wide for 5 to 10 minutes. Create a full air exchange. Step outside briefly, warmly dressed, and breathe slowly. Notice the sensation. Not as a cure, not as medical advice, but as a forgotten layer of respiratory hygiene. If symptoms are severe, persistent, or accompanied by fever or breathing difficulty, seek medical care. The winter air rule was a complement, not a replacement, for wisdom. The deeper lesson isn't about cold. It's about remembering that many traditional health practices emerged from careful observation of patterns over generations. Some were wrong, some were incomplete, but some were quietly effective. We modernized comfort, but may have underestimated airflow. So the next time a cough echoes in a sealed room, ask yourself, is the problem the winter outside, or the air we refuse to let in? Maybe the rule never disappeared. Maybe it's still there, waiting on the other side of the glass.